Welcome to the museum.
Thanks, George.
So it was pretty clear after yesterday, no Republicans came out and said they could now consider the president's plan, and the Democrats say they're not going to start over. So what happens now?
Well, I hope that they would start over. The president's very good at defining the opposition's position in a way that's most favorable to him. He said, for example, we can't afford another year of debate. We're not saying we want another year of debate. What we're saying is, let's start out on these areas we agree on, whether it be medical malpractice reform or taking care of those with pre-existing conditions or a number of other issues, and go step by step. And the other aspect of it is, you would not know from the way the vice president just spoke, the American people overwhelmingly are against what they're trying to do. And they really are. The reason why I brought it up yesterday was not because of the campaign, but because the American people don't like these unsavory deals. The issue came up twice about Florida, and the 800,000 people, because where they live in Florida, will not be subject to Medicare Advantage cuts. Now, you know, Medicare Advantage is a very popular program with seniors. Now, you can argue, I don't agree with the argument that it might have to be cut, although I don't agree with that. But to say carve out one group of 800,000, and there's 300,000, 30,000 in my state who have Medicare Advantage that are going to be cut.
But when you made that point, excuse me,
unsavory.
The president said you had a point there. He also said he was willing to work with Republicans on malpractice reform, on health savings accounts.
Does that mean he's going to undo the pharma deal, the health hospital association? He's going to now he's going to go back to his position where he supported drug reimportation from Canada instead of the deal they cut behind closed doors?
He did lay out 3 or 4 areas, including that Medicare Advantage issue, where he said, you know what, you guys might have a point, let's look at it. And all he closed with was a plea for Republicans to look at his ideas. Take a look.
I'd like the Republicans to do a little soul searching and find out, are there some things that you'd be willing to embrace that get to this core problem of 30 million people without health insurance and dealing seriously with the pre-existing condition issue?
We would be seriously interested in dealing with the pre-existing conditions issue. We have a proposal for establishment of risk pools so that insurance companies can compete.
But they only cover about 3 million people, not 30 million people.
If you establish risk pools so that people who have those pre-existing conditions, that the insurance companies can compete for them, that obviously would, in our view, make significant progress in that direction. If you lower the cost, the thing that's driving people out of health insurance in America is the escalating and dramatically increased costs. And here they are with a program that's another $2.5 trillion cost to the taxpayers. So we are ready to work on a number of issues with the president, but we want to do it step by step.
So
we
no
don't
comprehensive
want this budget gimmick. We don't want the budget gimmickry that gives you 6 years of benefits for 10 years in taxes. I mean, that's crazy. That's Bernie Madoff accounting. So we want to work, but we want to work step by step.
But you don't expect that to happen
So
now,
does
do
the
you?
overwhelming majority of the American people. I hope we will. I hope we will. There are areas that we can agree on. But to go to the 51 votes, and instead of this traditional 60 in the United States Senate, will have cataclysmic effects. And by the way, the vice president said he didn't know what the American people. I know what the people in Arizona want because I've been traveling all around the state, town hall meeting after town hall meeting, phone calls, letters. They don't want a massive.
But they also say they want to get something done. And on that point of the 51 votes, the reconciliation has been used for President Bush's tax cuts, for welfare reform, for other health care bills in the past.
George, it's not been used for 1/6 of the gross national product. Robert Byrd said that. The expert in the Senate said it would be outrageous if we used reconciliation for this issue. So we all still want to sit down, we want to negotiate, and we want to try to get something done. But the majority of the American people say, start over or don't do anything. Obviously, we can't not do anything because Medicare is going to go broke.
Yeah, so just bottom line, it doesn't seem like the gap has been bridged between you and the president.
I think it was good to have that conversation. I think it was good for the American people all over the world that watched or educated on the issues. They're very informed people on the issues. I think it helps the American people make a judgment. I'd be glad to go over again.
Okay, Senator McCain.
Not soon.
Thanks for your time this morning.
Thanks, George.